Norland, and I run the environmental division. I'm an environmental engineer by education and also by profession. And we have folks on my staff that have certifications in both lead as an inspector and lead as for inspecting contract work as well. Jeff already mentioned that the Reuters article of 16 August, followed by an Army Times article on 17 August, followed by several follow-up articles, and I think there have been a total of 5 now that have addressed the some portion of the lead-based paint in family housing in some form or another at several installations. I write up there Benning, Knox, Riley, West Point. I believe Fort Polk, Fort Hood may have been mentioned in some form or another in some of those articles as well. That brought it to the national attention, and so our town hall is to address that. Next slide, please. So where does the lead come from? Lead-based paint is what we're specifically talking about, and we've already heard that it's been in paint in the past. It makes it very durable, and in fact, we still have lead-based paint for industrial purposes. For instance, bridge paint is lead-based paint. Some traffic paint for the durability on the asphalt is lead-based paint. It is banned for residential use, though. So housing or paint used on residences since 1978 should be, I'll say, free of lead-based paint. There's a very, very small amount that's still allowed in it, but it's less than a fraction of a %. Lead-based paint, whether it's covered up or whether it's still exposed, does not pose an immediate threat, an immediate hazard, if it's left intact. If it's not chipping, if it's not being rubbed, lead-based paint intact on the wall is just fine. In most of our historic houses, that's got 1, 2, 3, 4, 5, 6, 7 coats of other paint over the top of it. I believe I counted 13 when I lived over on Meade Avenue. But if it's covered or if it's intact, it's still fine. So it's the issues where, particularly where we get dust, rub areas. So we're interested in areas around hinges, around door frames, around window frames, where sliding and rubbing occur. And then, of course, corners that get chipped a little bit. There are some other sources of lead in your household. Next slide, please. This list just is a selection from a variety of documents. HUD and EPA both have long lists. This is not to say that every one of these things has lead in them every time, just like paint doesn't have lead in it every time. But ones that might be of concern to you, children's toys. We have in the past found that some painted toys and some colorful toys, plastic toys, the color itself has got lead in it. Not so much an issue here at Fort Leavenworth, but you may have a work hazard, particularly if you or your spouse work on the ranges and spend a lot of time as an ammunition handler or out on the ranges. And so important there not to bring, quite literally, your work home with you in those conditions. And you might have some of these other things in your house or might be exposed to them. For instance, secondhand smoke. There is a quantity of lead in cigarette smoke. Next slide, please. I believe at this point I get to hand it off to Colonel Maurer.
Good evening. I'm Colonel Maurer. I'm the commander of Munson Army Health Center. My background is in preventive medicine and public health, so I've dealt with some lead issues in the past and previous assignments. I have my command group, with some of my command team here with me today. I have my Sergeant Major, my incoming Sergeant Major, and my Deputy Commander for Clinical Services. So she's a physician, and if we have some questions later that deal with physician, doctor-related business, I'm sure she'll be able to help me out. Basically, though, lead is not desirable. There's really no determined safe level for lead. However, it's very common, as we've shown in the previous slide, in the natural environment and in the man-made environment. Children with blood concentrations of lead less than 5 micrograms per deciliter have been shown to have perhaps there's a possibility exists that they could have some mental diminishment in mental abilities. Children with higher levels of lead may develop anemia, behavior, and learning problems. We're most interested or concerned about lead exposure to children, mainly because children are still developing their nervous systems, their mental abilities are developing, so they're a little more susceptible and vulnerable to lead exposures. Another concern with kids too is because they like to put things in their mouth at an early age, they're also ingesting more lead than what you would imagine an adult would. Throughout the presentation, if you all ever have concerns about lead, you should speak with your healthcare provider. My staff is well aware of the lead-based paint concerns and is prepared to field any questions you might have. The next slide is the money slide. Basically, it tells you what we've seen clinically at Leavenworth over the last 3 years. Essentially, we've only seen 2 cases of slightly elevated blood lead levels out of the 934 tests performed. We had 1 case in 2017. That was a child that lived off post in a historical home. And if you live in the Leavenworth area, it being the oldest city or the first city of Kansas, there are a lot of historical homes in the area. That child had some siblings that were also tested for lead. None of those siblings had any elevated blood lead levels. And fortunately, if you can remove the source of lead from the child, usually within a short period of time, a month, maybe 2 or 3 months, their blood lead levels will drop to normal levels. That's what happened in this case. Then we had 1 case in 2018 of a family living on post. There was 1 child that had slightly elevated blood levels. The child had a twin. That twin had no elevated levels at all. There were other siblings in the house, no elevated levels, and as a result of after 2 or 3 tests, those levels too went down to normal levels. Just so you're aware too that children under 5 years of age, there's a different reference level for blood lead testing, and that's 5 micrograms per deciliter. In children between 5 and 15 years old, there's another higher level. Since they're a little more developed, there's not considered a risk for a higher level later. Next slide, please. So what to do and who to call. Just reiterate again, if you do have any concerns about your children being exposed to elevated levels of lead, we urge you to come see our providers at Munson Army Healthcare Center. If you want your child to get a blood lead level test, that has to be ordered by a physician first. When we do take a test, we send those results, send a blood sample to Fort Sam Houston, and it takes about a week for the test results to come back in. It is a venous blood draw, meaning that the child will get a needle stick, so it can be somewhat traumatic and distressing to the child to get the test done. But if there's a warranted need for it, our providers will certainly order the test. That's all I have. I'll be followed by
Michael's Management Services. Most of you know Deb Healy or Sean, our facilities director here. So I'd like to spend a few minutes telling you what we have here at Fort Leavenworth. Okay, we started the project, we had roughly 1,600 homes. Out of those 1,600 homes, part of the project was to demolish just a little bit over 700 of those houses. All those 700 houses were pre-78 homes, so we basically halved the number of homes that had lead-based paint in them. You know, currently we have 634 remaining that have lead-based paint in them. You know where the historic homes, Santa Fe, the old one-story Oregon, and the upper Kansas units. Okay, those houses were built before 1978 and have lead-based paint in them. And as was talked earlier, each one of them has been painted over and over again over the 40 years. So the lead-based paint itself is essentially under layers and layers of latex paint. And what we've been telling you is, in order for that paint to be harmful to you or your family, is that paint has to be disturbed in some way so that those lower levels of lead-based paint are accessible to surface. So usually, you know, if it's chipping or peeling or friction points, where windows open and close, those sorts of things. Okay, in order to evaluate the paint in your home, there's training that's required, so we have certified individuals that can inspect lead-based paint, as well as the environmental group also has a device that can detect the presence of lead-based paint in various spots. Since over the 40 years, a lot of the homes have been renovated in various places. Some portions of your house, actually with lead-based paint, has been removed and replaced with something newer. Okay, what we do is we inspect the houses at periodic times. Somebody moves out, as you know, we get an inspection before somebody moves in. At that time, we attempt to make sure that all the paint is in good condition, meaning not peeling, chipping, or flaking. Okay, so that's our intent. What we ask you to do is when you move into the house, you get a condition report to look. If our inspector missed one of your windows or doors, you see peeling, all we ask you to do is call us. There's no charge. Basically, the repairman will come in and repair the paint. There's a process they have to use. Or if depending on the quantity, we'll bring in certified contractors to actually repair the paint. It takes a little more of a process. Okay. When you moved in, I don't know if you remember, but at the time we alerted you that there's lead-based paint in your house. We gave you a brochure, what looks like that, some on the table over there. We also asked you to sign some documents. Why? Because we felt this is important. Okay. As we talk, even though we don't have very many cases of elevated lead found in children here at Fort Leavenworth, there's a possibility that you could have that, and therefore you should know that you're looking for painting, chipping, peeling paint. And that's what we ask you to do. All you have to do is call. Okay? Our community manager, Deb Healy's in the back. Obviously, if you have any concerns about your house, call us. If you're not sure, give us a call. We'll send an inspector out to look at it. We've done this at a number of Army bases, and we're having similar results there. Very few cases of elevated lead in children exist throughout the Army, despite the Reuters report. Okay? With that, let me turn it back to Dale, and he'll take us.
About the quarters, I'll talk a little bit about the rest of the installation or other facilities where your children are probably occupying. First, let me talk water in general. American Water is our water service provider. They do an excellent job of giving us water that meets or exceeds all of the standards, including those set for the lead and copper rule. Lead and copper rule requires every 3 years that they test. In our sampling, it's 30 houses or 30 locations. 17 of those locations are in pre-1978 quarters, so may well be one of your homes. 11 of those were 0 non-detect. 6 of those were 1.2 to 5.7 parts per billion. The action level, the standard is 20 parts per billion, but the action level is 15. And so those 6 were well below the action level. So the water that we're receiving here on the whole installation is well below the lead standards set for by the EPA. Your children may attend school here. We have 2 schools that were built prior to 1978. That's Bradley, 1964, and Patton in 1958. Both of them have been completely renovated at least once and passed all of the state inspections for schools regarding lead, asbestos, and other things. And so they are lead safe. Patch Community Center houses our SKIES program, and they're on the first floor, and we have inspected that as well. If you've been in there, you'll note that trim, doors, windows, and things of that nature, door casings, are still the old original wood. They've not been painted, and therefore we don't have some of the friction points that you might in an otherwise painted facility. And the rest of the paint in there, while having lead-based paint layers down, is in good condition with latex paint over the top of it. All of the CDCs were built after 1978, and so not using lead-based paint as part of their material. And in fact, also Munson Army Health Center, constructed originally in '61, but several renovations since then. And it too is lead safe. So those are the facilities that your children may spend some time at, and those are the conditions that we have for those. Next slide, please. So what can you do to reduce? I mean, we've already shown that with things are in good condition, your exposure is at a minimum, but there are several things that are prudent things to do. First, of course, is don't dry scrape or dry sand anything. That's a process where you might potentially create lead-based dust. So those that are certified to work in it do what's called wet processes, maintaining the surface, a mist on the surface so that dust does not get in the air. Of course, I already mentioned, inspect your painted surfaces and then report any issues. Let's see. Not having access to peeling paint or chewing on surfaces. I suspect it is a natural tendency for children to try things out, but if you see that they are consistently doing it, take some action to prevent them from chewing on paint and painted surfaces. And this, I would include their furniture, cribs, beds, and things like that. Addressing water damage quickly so that water doesn't get behind the paint, break the adhesion to the material there, and then cause peeling. And again, Ron has given the numbers there to call in order to get a team to come out and look. This is the important one here. Damp wipe the places that do have dust. Damp wipe the window ledges, damp wipe around the doors, so that if there is dust, the damp wiping picks the dust up and does not make it airborne. What you particularly would prefer not to do is dry dust it, because if you shake that dust rag, then you put that dust right back out into your environment. Not an issue for us specifically, but cold water has less of a tendency to leach lead than hot water does. So starting out with cold water is good. Flushing outlets is never a bad thing. That way the first few cups of water that come out, the first few liters of water that come out actually, if that's been in contact with lead, that goes down the drain and not into your system. You have little aerators on your faucets, little bits of minerals and perhaps small filings of brass from the brass fittings could lodge in there. Periodically take those out and clean those out as well. This one about avoiding containers, dishes, pans, etc. That might have lead. I particularly, in an earlier slide, you saw pottery there. Some types of glazed potteries have a high lead content in the glazing. And so if you aren't sure about where your pottery came from, it might be wise not to use that. And then there are certain hobbies, and I mentioned this before, I had that on the list before, with stained glass. If you cast your own ammunition, load your own shells. The only other one I can think of off the top of my head is little tin soldiers, if you have a tendency to cast those and paint those. Just work cleanly and keep the children away from it. Don't let them play with the lead shot, as satisfying as it is to hold small lead pellets just because of their density. Next slide, please. What I've just had on that slide, plus many more items, are available at this website. This is Kansas Department of Health and Environment, the KDHE site for lead or healthy homes, which has lots of information about lead-safe homes. And additionally, EPA, CDC, and HUD all have some of this same information in other formats. And if you go to any of their websites, Google EPA and lead, you'll come up with several brochures and several publications that you can tap into. With that,
there's really only two takeaways from this slide. One, the Army is developing a program to validate that its current procedures are effective in managing lead. We don't have the details yet of that program. We know it's going to start with a data call and all different types of housing that the Army is involved with, whether it's government-owned, leased, or RCI housing. And we'll obviously support that program to the very best of our ability here, because we have the same concerns. We want to make sure the program is effective here as well. Next slide. Jeff, I think I turn it over to you.
At this time, we'd like to turn the forum over to questions. We have our subject matter experts here ready to address your questions. Yes, ma'am.
Question. I have a question for Mr. Hanson. I live in Santa Fe, and our master bedroom additions were, can you tell me when those were added on?
Those were all brand new, they were like in the last 3 years.
Oh, okay, so they did our roofs, and a lot of the nails are still hanging out on the inside of the roof, where like, they nailed it down on the top and they fell through on the inside, but I think it's mostly only in the masters, but if it's in the other rooms, should I assume that's something I should call housing to
Well,
fix?
anytime you have a defect in the house or something's going wrong, please call us. I mean, we can send somebody in and fix that pretty quick.
House or outside, what are the proper procedures that housing should take to abate it, I guess is the question?
Well, actually, the abatement is trying to remove the lead-based paint from a house. And most of our homes, we can't do that because of basically the historic nature of the house. So there's a procedure called RRP, which is, one of the R's is for repair, renovation is another one. EPA has a set of standards, as does the state of Kansas. So all our staff that work on any sort of the paint or lead-based paint have to be certified by the state of Kansas, as does our company, and likewise any of our contractors that come. The process will be explained to you, but essentially they have to basically isolate the area, and then they have a process they have to go through to make sure they minimize the dust while also protecting the worker. And then once they basically remove the peeling or spray paint, then they can put a new fresh coat of paint on it to seal it back in. And actually they have a test that they do at the end to make sure that it's free of lead. And then when it passes that white test, then they're allowed to go to the community manager and let them know it's safe to basically reoccupy that area of the house.
I guess I called probably around a month ago, and it took a month for them to come. I had my whole porch, I live in Oregon, and my whole porch was chipping, and it took them a month to come out, and then they didn't scrape or anything, they just painted over it. Is that correct?
Okay, well, I have to check on the details of that, but, obviously there's concern for the interior of the house where usually the kids could be walking around or crawling or that sort of thing, and then the exterior of the house is somewhat of a little bit of a different standard because of, then we're worried about kids eating dirt. So really it's a question of how much, paint chips would fall, and then of course whether the kid is gonna eat the exterior paint. A lot of the exterior paint, I'm not sure whether it has lead in it or not, especially outside, but we have ways of testing that. So if you just call us, we can check. Okay?
I have a couple of questions. So with this revelation of the lead everywhere, are you having more momentum in taking care of the problem? Because a few years ago, in my bedroom, about a quarter of my wall was peeling, and it took several phone calls and maybe about a year to get that taken care of. So this sounds nice, but the reality of getting the work done is not timely sometimes.
Okay. I think one is it's not a new revelation that there's lead-based paint in your house. Okay.
I mean for the community and this article.
Okay. So the concern about your safety or your children's safety is consistent. On maintenance practices, Sean's back there. He's in charge of facilities now. Okay, and I can tell you that we've had some change in turnover of leadership there. So Sean's the person now, and he's the one we're holding accountable to make sure we are timely, to keep you informed. Obviously we have 1,600 homes, so we're trying to put all the urgency on lead-based paint, especially interior, especially if there's a 6-year-old or below in the house. So we're kind of prioritizing that because we realize that with the article coming out, there may be a renewed interest on everyone's part to say, I'm going to go and look at this paint, whereas maybe before you didn't. So we're expecting that we'll get some more calls, and we're prioritizing anything in the inside of the house with the 6-year-olds or less, and the other kids, and then the exterior. And what we've done pretty much everywhere is anticipating that with people paying more attention, to this, as well as our staff, we're gonna have more calls, so therefore we need more help. So we've hired 2 national firms to augment our force, so that way we'll have enough workers to go around with a more timely fashion.
Kind of question,
Can I add something real quick? So if you're not getting the responsiveness you need from the housing, I would say that that's what Garrison's here for. And we have a team, there's a team, Mr. Fields, who works for Garrison. And sometimes it's lost in translation, it's not even, and we're here to help you guys. I will tell you that the Michaels Partners have done, the Army would never have been able to afford tearing down 700 plus houses. So the reason that some of you are probably not living in those, because you wouldn't be here, right? But those guys are living there is because they came in and the Army couldn't do that. But I will tell you that we have records. It's not a new revelation. The environmental guys showed me a packet. So if you live at, 312 Grant, there's a packet of information that catalogs the entire history every time we've done testing inside the house about lead paint. This is something that the Army and Michaels takes very seriously. So I ask, if you're not getting the responsiveness, give us an opportunity to make sure that they understand that they need to be responsive, because that's not their intent.
okay.
They're normally pretty responsive. So please let us know, because then we could go and talk to them and say, hey, look, have you figured this out? And there could have been a mistake. Things get lost sometimes, and they don't. They're trying to do what's right to take care of the families here.
I also had a question. In the article, it did not only talk about lead paint, it also talked about asbestos and mold. We have a mold problem in our house that I've been having a hard time getting help with. We had a mold problem in our old house. So what is, and I didn't sign a waiver to live in a house with mold. So, what is your remediation process?
Mold is a household issue, okay? So it's caused by moisture. Here in Kansas, with warm temperatures, high humidity, you're gonna have mold and mildew in your house. Okay, there's certain kinds that we're, very cautious because it causes some environmental issues especially for respiratory. So we're concerned with it. We ask you to call us regardless. You don't have to decide what it is. Just let us know, because what we're anticipating is we're gonna have either some sort of moisture problem, where it's not the exhaust fan not taking the moist air out, whether it's maybe a leaky duct somewhere that basically cold air is going through, and there's some sort of condensation issue. There's a variety of things that can happen to create a mold situation in your house. What our guys would do is go in the house and see if they can identify what the source of the moisture is. And that's the real challenge, especially, just about anywhere in the United States is wherever there's moisture and there's warm temperatures, we're gonna have some mold.
And I just want to hand this to someone. This is a testimony from my old neighbor who didn't look like she was in your statistics, but in 2016, her baby was tested high for lead on Auburn, and they moved her and then moved another family right into the house. And there was another woman also on our street whose baby tested high for lead.
I think, as we're talking through this issue,
Yeah.
okay, anytime we don't get notified if there's elevated lead. So if someone comes to us to talk to us about it, then we usually go through, say, all right, well, the best thing is to try to get you out of that house and try to put you in a non-lead-based paint house. Is that the first? This is what we're trying to do, is have a result where the lead level in that child is reduced as fast as possible. Okay? If in the past someone didn't respond quick enough, or you say, well, we moved somebody in some cases, the the health professionals have to go do a determination to try to figure out, well, why is there an elevated lead-based paint or elevated lead level in a child? It may not be because of the house. Okay, the stats that Boyd just put out, the 31 houses that they talked about at Fort Benning, 19 of those were off base. There weren't even houses on Fort Benning. Of the remaining 12, 8 were in brand new houses. Only 4 were actually in houses with pre-1978. 2 were thrown out because a family from Europe just moved into one, so there was no time to take it. Another one, the child swallowed a fish sinker. So they identified it down out of 31, it was only 2. So there's other things out there that could result in it. I'm a retired Army guy, you know, I have a crib that came from Holland, I have all kinds of pottery and stuff like that. I had crystal glasses from Germany and Czechoslovakia that they said they were lead crystal, so I imagine that, you know, the kids shouldn't drink out of them, but you know, those sorts of things apply. So if you have any concern, please see us back there. We can come and check. You know, we have the ability to check for lead-based paint, and we can obviously check your paint.
Josh, do you have a question for us?
Question about how to do lead abasement on dust when you drill a hole into a wall or they hang a picture or a shelf. And then not just for, you know, personally abating the lead dust that I imagine, you know, since you drill all the way through into the drywall, you're gonna reach the last layer of that. But then also, people move in and out of the houses in Santa Fe every year. Do you guys test those houses somewhat regularly? Or do you just kind of put paint over all the holes and all the walls every year?
Well, the first part of your question, you know, I'll ask, my guys back there to answer the question, because, the idea is you're trying to avoid something that creates dust that can be ingested by a small child. Okay, so the fact that you're drilling into a wall means you are going through the layers of latex paint into lead-based. So that dust does have lead-based paint in it. So you need to be aware of that, and then either wet, like you recommended, wet dust it, or to deal with it that way. Okay, on the house inspections, every house gets inspected during term. Okay, so people do go in there and look at all the windowsills and the door frames and all that. Do we get 100% of it? I've learned a long time ago that, I can't, but that's why we say to you, and we're gonna change some more checklists to say, what we're looking for is chipping and peeling paint. Whereas some people, when they move in the house, you're just thankful to get into the house and get your boxes in and get, thing. And we know you may say, hey, this looks fine. But we probably need to do a better job on our side to inspect the house, and then ask your support to do likewise. Because, like I said, it's just a phone call away. If you call us up, we're gonna respond. That's one of the things is we're changing some of our procedures to say, we'll give you a higher priority on a lead-based paint call in your house so we can respond a little quicker, at least to give you the answer of what's gonna happen with it. Whether we mark it, try to seal it off, what are we gonna do about it in a quicker, more timely fashion?
A technique for drilling, and not addressing whether you should be drilling or not, but a technique for drilling is to mark your spot, put your drill bit on there, spray shaving cream on the spot, and then drill. The shaving cream will adhere all the dust, and then you can wipe that away and it won't be airborne.
So this was not a new issue. I mean, that wasn't communicated to us when we moved in, like, don't paint a bunch of stuff on the walls.
Josh, you had a question back there?
You said you managed about 1,600 homes, and out of those, about 6,700 had to be demolished. What criteria did those houses meet that they had to be demolished?
Well, if you were here back then, you knew they needed to be demolished. Upper Kansas, which, across from our community center, you had the twin. Lower Kansas was all in 3rd Infantry and was running on that section. Delaware Village, there were a lot of houses, and essentially those houses had been built in the 50s and 60s, and the standard was, the oldest, worst conditioned houses went first. Okay, and the better houses were retained. Upper Kansas, kind of the exception to that. This was, we're waiting for permission to go ahead to replace those. And then the plan is Old Oregon would be the next village up.
So Old Oregon will be demolished eventually?
Yes.
Will any other houses on base other than Old Oregon be demolished as well? In the foreseeable future?
Well, we'll still have the historic homes. There's 269 historic homes that will always have lead-based paint in them. And the State Historic Preservation Office, loves those houses and the historic nature of those houses, so they will always be around. Old Oregon, Upper Kansas, that's probably in the near term, say in the next 5-10 years. You know, the next group, the Santa Fe houses, we did a major renovation. I think the next thing I'd go after is I'd probably go after windows and doors. And they're not historic, so we have somewhat a better opportunity to do that. You know, the thing that complicates a lot of this is there really hasn't been a lot of elevated lead calls. So, you know, whatever the process right now has prevented kids from seeing too much evidence of this. But the article did point out that it is a concern, and it should be a concern, and that therefore we have a renewed emphasis on it. That's why we're here tonight, and that's why we're putting out information. And the Army's doing this Army-wide, basically, to make sure everybody's aware, and then that all the procedures are working. So I know we'll be checked, you know, by the Army here in the near future.
We have a question right here.
Just a real simple question. It's just have they done a study on what the possible soil, lead soil contaminants in the neighborhoods being, as you said, these houses have been here forever, as they construct them, a lot of that stuff got into soil, and then over time, has there been a significant increase in lead, or one that should be of concern?
We don't have a systematic survey of soil lead content in the drip line or in the yards. There are just a handful of cases as we were doing investigations or helping with investigations for elevated blood level where the drip line soil was checked. It is part of, or expected to be part of, the assessment that will be coming up. I don't know that we will specifically be sampling, but we will be examining it for evidence that it's had lead-based paint chips in it.
There's a question right here in the middle.
Thank you. My family moved into an infantry barracks home in June, and I knew that I was moving into a historic home, and I myself grew up in a Civil War era farmhouse, so I know what to expect in older homes. What I wasn't prepared for is that the home has not been well maintained. There are several places throughout the house, door frames, interior door frames, where there is sticking. So every time a door is opened or closed, we have rubbing down to the bare wood. The exterior door frame has original lead paint with no new paint over it at all. The exterior pillared column area that is the main entrance into the home was dry scraped and repainted, I think in July, so there were no lead safe practices used while that work was being conducted. There are areas around the heating and cooling registers where there has been water damage to the baseboards, and there is chipping paint down to the bare wood there. I could go on and on. So we're living in a historic home, or my family's no longer in that home, but that's a historic home that we moved into. And it was the move-in inspector 6 weeks after our move-in who brought a lot of these issues to my attention, so I appreciate that he was attentive. But it's been my observation that the homes in infantry barracks have not been carefully maintained. Obviously, there's very high turnover of families in many of those units. We should expect that the people who are supposed to have been maintaining the homes properly are now going to come in and do proper work to mitigate the risks posed by the lead. And it's been my observation, and also I've heard stories from people, that the work has not been performed in a safe manner, or sometimes someone comes and it seems to be that they're using lead-safe practices, and many times people come and they're not doing work safely, whether that's the interior or the exterior of the home. And I've heard no acknowledgement of that particular problem. I've heard we have old buildings on this post. I haven't heard that we have old buildings on this post that have not been very carefully maintained. And obviously I'm not asking many questions, but I will tell you why the numbers shared from Munson don't give me peace of mind. It's because children are routinely tested. There's a blood drive 12 months. So if you happen to be living here when your child turns 12 months old and you take them in for a well child visit, you may catch an elevated blood level. But if you're only living here for a year and you are trusting that the people managing your home are doing so properly and you don't know that there are lead exposure risks, you're not necessarily going to take your child in to get a blood draw, which is very unpleasant. I've had it done with my children. So those numbers don't really give me peace of mind about the lead exposures in historic homes here, especially in Indian areas. And I would like to know what your level of confidence is that the work that's being performed to mitigate these risks is being performed properly.
The thing is, that's a long list, and obviously, all I can say on some of your lists is, please come and see us in the rear afterward. And for any of you, obviously, our intent is not to have you have a bad time when you're here at Leavenworth. Okay? We want to maintain your house. You know, the folks that work in the maintenance crew don't get paid by what they do and all that. They have a salary and to do their job. Okay? And we expect them to do their job. Okay? And I expect our supervisors to check their work and make sure it's done properly. Okay? And if it's not happening properly, we just need to know about it. Okay?
So again, it's on us to
No,
know.
I'm not saying it's on you, but if you see it, let us know. If we see it, we'll take action already on it. Okay? You know, we have people that go out and check our work, and they are checking turn maintenance, they're checking some individual. We have supervisors. You know, they're all sitting back there and hearing this. Okay? We've gone through a number of maintenance managers over the past 10 years, trying to find the right ones. They're good people. They're not trying to do a bad job. They're trying to do the very best they can. Okay? They may screw up. Okay? And any way we find out, if somebody's screwing up intentionally, they're not putting the effort for it, we want to know about it. If you tell us or we see it or whatever, we take our own action. We're going to do that. Okay? The lead-based paint situation we're in now was highlighted, from a case at Benning, and it's got everybody's attention right now. Okay? We were already worrying about this, and I know the Army and the Army partner that we're working with will tell you the amounts of effort that has gone into lead-based paint, trying to get ahead of exterior porch work, the wood here in Kansas. So it's our intent to do a good job.
We need more than intent, though. We need to know that you are doing your job and doing it consistently so that we don't have to worry about it. That's not our job to make sure that it's being done right. That's your job.
That's my job.
Yes.
Okay?
And it's been your job.
And I heard you. Okay?
Josh, we have a question back here.
Hi, one of the things is that we've heard consistently is if we have a concern, call the right people. I've been very fortunate with the housing office to get the right people. I've also have been a military spouse, and I've also worn a uniform, so I'm a little gutsier than some other families might be. What I would like to see, especially being new to the area, is somewhere the base Facebook page. Who are these people? Phone numbers to reach these people at the garrison level, the housing level, the maintenance level. And if you put Mr. Brown on that roster, and he's supposed to be the specialist for trash removal, just say, when you call that office to expect a response, I think the frustration level at it could just be something very simple, is you think you have the right person, you get a voice message, you don't get a response, and it could be, oh, you need to call B, but C should respond, maybe it's A. some of these phone numbers publicized and approachable, and have those people be able to respond. Or have a representative, Garrison Open Door, Housing Open Door policy, something like that. So these people don't feel frustrated because no one's answering a question that we don't know who to ask.
Hey, Deb, could you ask the staff just to stand up, say who they are and what they do?
I'm Deb Healy, I'm the director for my military here, Frontier Heritage Crews. My door is always open. I'm happy to respond to any call you might make to me. I've got Sean Rose, who's our facilities director, Bradley Thomas, our town crew director, Dave Ketchum, in charge of porch repairs, and down in front, Arlene Martinez, she's the assistant director for housing, and Sam Gordy, she's our office manager at the maintenance shop.
So then on the Garrison side, Mr. Fields actually works in the same building as the housing office, but he's my representative in Garrison. My command sergeant major, and I will tell you that one of the best parts about having this job in Garrison is people know how to find us when they have concerns, because they want us to help them and make the organization and this place a better place to live. So I'm really lucky. I get people in my office all the time, and people are like, oh, don't you hate that? No, I absolutely love it. Sergeant Major and I get to help people make things better, and so we're really, really blessed with that. And then Bill Waugh, who spoke earlier, is Mr. Fields' boss, and so he's available. We have all of our phone numbers down here, so I mean, if you're not getting the answers from us that you like, then you go to, please let us know, and then that's what me and Sergeant Major are here. I would also like to introduce my new deputy, Miss Heidi Larchek, who just came on board about 2 weeks ago, and so we are here to support those here in Leavenworth. So.
Yeah, just piggybacking off of what this woman said, I was wondering, you said that your workers are doing the best they can. I was wondering, do you feel like your supervisors and workers have all the resources they need to be able to get all of this work done?
Yes, I do. You can ask them, they're back there.
Mike, I think there's one right.
In that said that there was lead in the house, but I didn't expect that there would be lead peeling and chipping on our front porch where when we first moved in, didn't have furniture, and we're eating every night on this porch that had chipping lead paint. And I feel like that should have been disclosed when we moved in. And the only reason that I even noticed was that we were taking a walk by a house that had repairs being done, and it said lead paint. And I thought, well, if that one has lead paint, why doesn't my porch have lead paint? And so we bought a screening kit and tested it, and this was before the article came out, that we then discovered there was lead paint on my porch. And why wasn't I told about something that you guys knew about in a place where my kids were playing and eating and living? That's my question.
Well, like we were saying, or I've said a couple times, there's lead-based paint in those houses. The historic homes have lead-based paint. Okay, we didn't ask you to sign a waiver saying, I'm okay with living in a house with lead-based paint. We gave you information on lead-based paint saying, here's things, here's where lead paint is, here's what you need to do about it. There are some things that a resident has to do in the house, and there's things that we have to do. We think when we moved in the house, we had taken care of all the interior paint issues, and for the majority of the exterior paint, which is somewhat of a different state. I know you don't want to hear it, but that's essentially outside, because we're concerned about the dust that can possibly go onto a kid's hands. Outside, I know peel and paint, I heard you.
And the door frame, where my kids would open the door and put their hand every day, coming in and out 25 times a day.
Okay,
Right there.
and the thing is, all I need for you, if you just see one of our folks back there,
It was fixed as soon as I showed pictures of the lead screening test and everything. It was fixed. My question was, why weren't we notified when we moved in that that was lead paint peeling all over the porch? It was known that it
Someone should have mentioned it more clearly then.
Hey, ma'am, I think you raised a really good point, though. Just because you signed an addendum, you know, with the lead paint, saying, hey, lead paint's everywhere, that we need to have that dialogue with people. These are the things that you're looking for. And to help people, you know, when they're looking. I knew when I moved into my house that it had lead paint, and I live in one of the historical houses. And I knew it was on the front porch, I knew it was on the windowsills, I knew it was everywhere. And part of it was because I've lived in a house like that before. But we need to have that open dialogue, so it's not just a piece of paper that you sign when you sign the lease. And make sure, hey, you guys, these are what we're looking for. So I'm sure that Michael's would absolutely have the counselors talking to people about it, because you're right, they fixed it when you brought it to their attention, but it should have been identified earlier to make sure that we're taking care of it. So I appreciate that feedback, because I don't think it's just a piece of paper. You know what I mean? It's something more that we need to have the dialogue with the people that are moving into the house, that you need to be looking for this stuff. It's all lead paint. Don't let your kids eat it. And if you see it, you know, I wish it had been identified as you were moving in, and that's what the walkthrough stuff is supposed to take care of.
It was identified though. They knew about it before we moved in. They knew about it before we said these door frames, you know, they are in the interior of the door frame. They have been under contract to be fixed for quite a while. It was a known issue. And you're right, it should have been.
Yeah. And I have to say that we also have the power to say, I ain't moving in this house, you know, like, and that's the other thing, is we need to make sure that we're educating, because this is not just a problem at Fort Leavenworth. It's a problem in Leavenworth. It's a problem in Lansing. It's a problem in Georgia. It's a problem in Texas. Anything that's before 1978 is going to have this as a problem. And the older these facilities get, the more problems we're going to have with them. And the encapsulation only does so much for it. And so I do think that we need, as a, you know, as senior leaders in the organization, to make sure that we're educating young families as they move in that lead paint is a problem, not just in the military, because if you rent a place off post and it's a historical house, you have the same problems off post. Lead paint is a problem, and it kind of frustrates me, to be totally honest, that it was utilized in paint for such a long, 1978, I was born before that, I got it, but the fact that we knew that it was bad for us back then, and we continued to utilize it, and it was accepted in the United States, okay? But I think we need to do a better job of educating people. To me, it's unsaid that you moved into the house like that, and we need to make sure it doesn't happen to another family, okay? And I will tell you guys, again, I don't think that Michael's is trying to get away from something and trying to hurt anybody. That's not their intention. They do flip, you know, 1,000 houses every summer. It is chaos here. We all know that. And for those of you that just moved in here, their intention is not to make things bad for anybody. They have joined us as partners to try to take care of the families. And it's not an easy job, but we need to do better to take care of the families that are here and make sure it doesn't happen to the next family. So I appreciate you bringing that up, and I think it's something that Miss Arlene and Miss Deb can deal with the counselors. I think it needs to be that discussion to try to educate people. Because I had the same questions, like, explain to me what this looks like when it's chipping. Well, ma'am, that's not really, you know, what I envision is not exactly what it is, and we can educate people on that better. So I appreciate you bringing that to our attention.
So a 3-bedroom on main post, but all the homes are a little bit different, and I have a completely finished attic. But when we moved in, we were told that housing does not deal with attics. We actually consider it our 3rd floor, and a lot of people do have this 3rd floor, and housing said, you know, we don't do that. So we do have a lot of paint in that attic that has not been painted for years, because they just haven't dealt with those 3rd floor finished attics that somebody did back in the 1970s. So with this coming up, with every room that is walled off and completely finished and heated and cooled, whether it be an attic space or 3rd floor, because a lot of people use it as their kids' playrooms, are we going to add those in now with housing that they are now taken care of and properly maintained as another living space? As my son's Xbox is up there, we have an office up there, I have all my sewing up there and all the games up there, so maintaining it is important to us, as it is heated and cooled in a living space. We don't use it as a bedroom, but it is a space where the kids can play. So that's one, and then I will piggyback on porches. Our porch has been on the list to be done, and I've talked to Deb about it, but is there any way we're going to kind of speed up the process or add more people to get these porches done? And are we doing the window frames along with those porches? Because my window frame was flying on me today. As the wind blew, a little piece of lead paint just came as I was sitting there waiting for my son to get off the bus. So the window frames on the outside are also really bad.
Okay, on the first part, I didn't know we were making a distinction within the house, so if you could see, you know, Deb, so I can hear what's going on there. On the order of porches, you know, the staff, you know, Sean could probably give you an idea of where they're at, because they have, I think, 4 crews working through on porches. I know they shifted a lot to getting everybody, the families into housing when the turn happened, so I'm not sure what the delay there might have caused it, but, you know, he's got, you know, basically the list, and he should be able to give you the answer on when you can expect to see somebody. Okay?
Let's take this question over here, and then we have one in the back.
I have a couple questions. First of all, with the lead certified staff, when lead remediation or work with lead paint is being done, does all of the staff have to be certified, or is just one representative certified if there's a crew in the home doing the work? I was just wondering what the standard was regarding who has to be certified. Does everyone have to be certified? Do they have to be there the whole time?
There's a variety of different requirements depending on what function they're doing, and whether it's a contractor or whether it's our in-house people. I have to refer to Sean. You know, he could tell you the exact makeup of it. We tried to get as many of our employees, you know, certified in lead-based paint or safe lead practice, you know, for our staff needs. And then we required the contractors to meet the state requirements for doing the work they're gonna perform for us. So the exact detail of that, if I can ask them to give you the exact, so I don't wanna give you the wrong answer.
Yeah, because we had lead paint work done last week, and the guy was certified, came and showed me, but then he immediately left and left 2 other workers there. This is all internal staff. And I had no idea whether they were certified or not. There's just concern that someone should look into it.
Dave, you know the answer to that question?
The PDHE requirement is that the certified person be within 1 hour of the workers that they supervise. We try to have someone on the staff in this case. If it's a contractor, then maybe it's within the 1 hour.
What do you mean by 1 hour, ma'am? 1 hour away?
1 hour away, that's the PDHE.
I believe everybody that was in your particular unit, they're all lead certified. I'm lead certified, the firm that we work for is certified. All of our trained staff's gonna go, I think, the middle of, or the end of September, they're all gonna be trained. Right now, they're all working under my certification, or Dave's certification, but in your particular unit, I believe everybody that was working there was all trained.
I appreciate that, sir. A couple other questions. One, I had a concern about drinking water testing coming out of my own faucet. I understand the process that, you know, the entrance to a neighborhood would be tested every so often. However, is there anything in place regarding specific homes being drinking water tested out of their faucets? I did call around, but just like the woman in the back said, I got very much, oh, you have to talk to this person, talk to that person, talk to the other. So I was wondering if there's a succinct answer as to, is that a possibility? American Water said, don't ask us. Does anyone know that out of your faucet post?
There is no Army waiver for that.
I know better than that. I know in our conversations with the headquarters DA is that the Army leadership is committed to testing water as, you know, part of this analysis, this CHAPS, you know, depending on who the water provider is. I'm thinking here, you know, we probably need to, let the DPW talk to the water providers, because I would be very shocked if they didn't.
Yeah, American Water said that they used to.
This is American Water?
Yes, and then they got something changed, the supervisor changed, or something changed, and now they don't do it. So I do think that's something that should be flagged.
Ma'am?
Yes.
Yeah, AWS is required by Kansas EPA law to test on a regular basis, and they do. The last round, it's not every year though, I think the last round was in 17. I think it was last year, the last time they tested, and they test X number of homes. I don't remember all the numbers, but they're required to, based on their inventory, test X number of homes, and we've never had any elevated levels show up.
I understand that, sir, but my concern is the pipes that my home was built in 1903 coming to my own faucet. So a random testing in other homes doesn't necessarily give you peace of mind. And I know I was in DC in a historical home, the water people came right out and tested as soon as I asked. So I think there needs to be an answer.
But the thing is, see Sean back there, we'll test your water.
Okay, sir.
You know, because the thing is, you know, we at some other bases, the water company was testing at the tap, and we learned a lot about, you know, the composition of faucets, composition of pipes, solder, whatever. You know, I'm pretty confident of some of the houses that we've seen, you know, they do pretty well. But the answer is I don't know. And, you know, but the thing is we ought to test and find out.
Yeah, I think there should be at least a cohesive answer.
So if you could see Sean, or Sean get, you know, addresses or whatever, you know, because we can do a spot check to see what we got.
Yes, sir, and my final question is regarding soil, and there's chipping paint coming off of the gutters and infantry barracks everywhere. It is in the soil that our children play in. I know that the environmental guys said that there's not any sort of systematic soil testing for lead, which I understand. Is that something that somebody can test, or?
Well, there are tests for soil, for composition. It's a little different, the amount of lead versus, you know, quantity of soil.
Or even just that those chips contain lead, right?
Yeah, but understand that the test is that they take a sample of soil and then they figure out what the percentage of lead in that piece of soil is.
Sure.
And we do it for a lot of, like, when we do the demolition work for the other previous houses, we had to do that to clear that the soil remaining was cleared. On your particular case in infantry barracks, you know, I'll take that one on too. I mean, you know, 'cause we're not here to hide behind anything, you know. If we're not sure of the answer, or collectively with the Army, if they're doing testing, we're doing, that's why I hired those national firms, because I said, all right, if we're not sure where we're at, let's find out. That's what they're here for. So just get addresses, you know, infantry barracks, you know, we know some of the issues on infantry barracks, you know, they work here too. So I know some of the heating and air conditioning systems, some of the ventilation in infantry barracks is a little different.
And the Army does test all water that comes on the installation, the Child Development Center, and the schools. We have the authority to test that. So when it comes into the onto the installation, we know it's clean. We know it's clean in the schools. We know, I mean, so the Army is testing those things as they come in, and so, you know, we're just doing.
Soil, is that what you're saying?
No water.
Oh, water.
So we run the contract, water comes in, it comes from Leavenworth, and it comes on, and that's all tested. We can test the schools, and we test all the CDCs and workplaces.
Yeah.
So the Army's got that side of it, and then he'll.
Let's take this question back here.
Sir, thank you for taking our question tonight. I live on Winds Avenue, to the historical side there with all the international students. There's been several concerns throughout the house. One of them has been the external tripping. I understand there's a different standard level on the outside. Totally understand that. I guess what I was told when I came in here, when we reported the chipping as being, you know, excessive, is that the paint contract is on a 7-year rotation. I don't know if you can confirm or deny that for me, or what we're doing to address that external paint issue, because I see that some houses on Riverside are being maintained right now, but there's some others that are quite concerned about that sitting back here.
I'm not sure what a 7-year paint contract is. Any of you guys know that, what that is? Can you help me out on wind painting?
So there's no rotational contract, so we can request our house to be painted. That's what I'm taking from this.
Well, no, we're looking at the standard in your house, and if your house needs to be painted, it gets painted. We do whole house paints on 50 to 60% of the houses each turn. You know, we're painting houses a lot more frequently than they would in the Leavenworth community. So, you know, so the condition you're talking about is, call us. It either needs it or it doesn't. If it needs paint, then it goes on to the work order list to get done. And the guys right there, the guys to see, they can take care of it for you.
Sir, I'm going to pass it out to some other families that are concerned about this as well.
And I said, I'm here, you know, right after the meeting too. So if you don't get an opportunity to think, I'll bring the staff down here. We have the work order folks here. You can check on the status of work order. If we're not dealing with a work order, you know, in a timely fashion, please make sure we have it, okay? And I know you're saying, oh, there you go, you're passing another task to me. All I'm asking is that I wanna get this problem solved. And whether you tell me or we go, in many cases, we have people say, oh, this has never been done, and we go and check the work order log, and we don't even have a record of it. They say, well, I told the move-in inspector that it needed to be done, and I guess they didn't write it down. Things happen, but the thing is, the important thing is trying to get something accomplished. Okay, that's what the lead-based paint issue is, the soil. If we have a problem, we'll deal with it. Okay?
I wanted to give a compliment. I know we are very new. We live in Riverside. We kind of get forgotten about, I think, in the Yellow Land. That's what we call it back there. But they're very old. And I've seen all of these gentlemen in my home. We've had great conversations. They have handed me a tissue with tears and have been very kind to me and with the utmost respect. I know they are working very hard. And for my children, I'm so thankful for that. I know time is not on their side. I know money is not on their side, and man numbers is not on their side. And I feel bad for that. I do call regularly for Sam, probably recognizes my voice, like Anna. I think I owe them flowers a lot. But they do really try hard, and I know they do what they have. I have a porch that is literally falling off. They've seen it. They've said, I'm sorry, we are getting to it, you are on the list. It's hard, I know. My kids, we don't eat on our porch to have a Sunday evening dinner where we probably could because of the paint, and that's just sad, because they're so beautiful, and they do need love. I don't know if you've seen them, maybe you should come around and come on in. I'll make a tea on, come over. I think you guys need to come and look and see what's actually going on. I know you're busy. I know I've asked to speak to, Sean today, and I was told absolutely not. He is very busy running around trying to make everything right, and I so appreciate that. And they've all been to my home. But I just want to know, how can we then support and get more manpower for you? These porches need to be taken care of because they're blowing in the windows. What can we do to help you, maybe? Can I turn it around? Is that allowed?
No, we're aware, Dave's now leading a team of people that are focusing on porches. And we've added, painters, we bring in painters. We have a number of contractors. The only issue, well, not the only issue, I just need to look in, and Sean and I and Deb and the other senior leaders will look and see, all right, where are we at on this and what do we need to still do? Because we've been focusing on, the turn first, and then, we've been working on porches now, it seems like 2 years, trying to get to every single porch. We've been working with the DPW on, what the standards for the porch now, because it has some historic wood on it. Can we use other products? I'd love to put Trex down on the deck so that way they last longer, but they want wood, for the historic nature. So we're fighting some of those battles. Resource-wise, I think, we'll visit with the staff and obviously, taking the input for tonight, because obviously we're not doing good enough. So we have to revisit that. It's not a money thing. We're not a contractor working for the government. We have access to funds to do things, just the right appropriate application of those funds. So that's what we'll have to talk to staff and see what we want to do.
We've got time for one more question.
Like I said, we'll be down here. We'll stay as long as we need to. Bring your concern. The staff's here. We can take work orders. We can check work orders. And we can do a number of things for you.
Thanks for your participation tonight. There is an informational table up here, so please come forward. Also, if you want to follow up on some issue tonight, there is a roster to sign up for. I'll turn the time over to Colonel Sutton to wrap up.
Hey, my name is Sergeant Major John Williams. Hey, I'm the Garrison Sergeant Major here. Been going about 6 months here, and I would tell you this. All right, for the garrison as well as our partner. Since I've been here, there has not been not one time that I have not engaged them where they have not went after trying to do the right thing to get things fixed. All right, and I'm going to just caveat once again what the garrison commander put out to you all. As with me being an Army soldier, my whole military career has been about soldiers and their families. Okay, I will continuously speak that my success in this Army has been about take care of soldiers and their families. All right, I love the Army, which makes me love Army families. So for the garrison side of the house, we work for you. All right, there has been many times, all right, that I have spoken to many individuals, and it just is what it is. Sometimes at the end of the day, everything that's broke doesn't get to us. All right, and if we don't know what's broken, we can't fix it. So this right here, this town hall, is an awesome opportunity to hear your voice. All right, this is your opportunity for us to hear it. All right, and I'm not just talking about us at the garrison leadership. We're talking about to the upper leadership with our partner, because sometimes the bad things that are going on doesn't get to us. Now, what I will tell you is this: there are individuals that, however they do it, they find you, all right, or they find the garrison commander. Whether they Google it, whether they get on our website, whether it's at the gym commissary, they're always welcome. It's a welcome interaction, because once again, we work for you. All right. Yes, we have a great relationship with our partners, but ultimately we work for you. So when I get contacted, or the garrison commander gets contacted, we immediately get with our team, all right, in collaboration with our partners, to say, maybe you're not seeing your blind spot. All right, just like we expect some of our leaders internal to the Army to come to me or the garrison commander or any upper leadership to say, you have some blind spots, because of course we're not perfect in anything that we do. All right, but the one thing that I'll stand on that, we love Fort Leavenworth. We love the soldiers that are here. We love their families. I truly believe that there is no maliciousness in that. We don't want to make sure that you're safe. That's one thing that from everything that I've seen for going on this past 6 months, I don't believe there's no maliciousness. Now, are there mistakes? Yes. But once again, forums like this, and sometimes it does need whether it's an emergency, whether something becomes a hot topic, all right, or an issue, it needs to be addressed, because guess what? It does put emphasis on there. I think someone said that. Yes, it does put emphasis on there, because we need to be reminded, all right, that there are bad things that are out there that we need to address. So once again, I would tell you, for those that spoke up tonight, thank you so much for, once again, providing us that feedback. We hear it, all right? We got to do a better job at getting after it. But once again, please understand that with the garrison, and I will tell you, even with the partners, all right, you might have to work through the process of getting contacted with the right individual. But on the Army family side, all right, that's what the garrison is for. We're here for you. So once again, you contact us. There has not been that one time that I have not gotten with our team, all right, that worked in collaboration with a partner that hasn't not been taken care of. So please, I ask you, utilize the garrison, all right, because our interest is your interest. We believe that the interest of the partner is you, but once again, when you talk about family and close relations, the closest, the next family member that you have that's close to you is someone that's wearing this U.S. Army or a military member that really do care about everyone that's in this community. So once again, I'll end this part by saying that, thank you once again for your feedback, because if we don't hear this stuff, there's no way that once again we can get after it and fix it and make things or start moving towards making things better. So thank you for your patience, ma'am.
Yeah. So So just real quick, to kind of put things in perspective, Sean, how many work orders do you guys do a year?
I don't know what the answer is to that.
Okay, I heard a rumor it was like 20,000, I don't know what it is. I mean, I think we have to remember that there's mistakes and things, but we got to fix it, okay? And that's what we're here. I know that we've got the infantry barracks contingent here that have some concerns and we need to have some conversations offline. There's some expectation management. The columns in front of infantry barracks are not old columns, that's not paint, that's got lead paint, and we need to do a better job of educating. And that goes to the lady's comment about making sure that the counselors are having this conversation with people about exactly what is happening in the house that you're, it's not just a piece of paper that you sign to, you know, cover anybody for a liability. That's not the intent behind it. We need to do a better job of educating everybody. But I would like to go back to one thing that I am concerned about. We're having the discussion about lead paint and housing right now, but what we're not talking about is where lead paint is every other place. If you go back to the Fort Benning, and that's the reason I have my phone, so I apologize, but there are 31 cases that were mentioned in the Reuters article. So let's do some stats on this. 19 were off post, and they can't determine what kind of houses they necessarily lived in, okay? But out of the 12 cases that came out from on post, 4 were in pre-1978 houses and 8 were in newer houses. So there's two things here. They could have moved from an old house to a new house, or they could have stuff in their house like toys made in a foreign country that uses lead paint, or they could be drinking out of crystal that we all bought in Germany or Poland. That we need to do a better job as a community, not only to look at the lead paint and the facility we're living in, but what else are we exposing our young kids to? Because it's out there and it's not just in the paint that's in our house. And so what I would ask is you go, you know, from here tonight, we'll take away the points. I think several of you, we need to have discussions about your specific houses. We need to do a better job of educating people when they move in here. But what I would ask that you do is go be a spokesperson and tell people that the stuff that you're buying at some store that's really, really cheap may have lead paint that your kid's chewing on. And, you know, I mean, the paint chips outside, you can stop them maybe from putting it in their mouth, but if that toy has it on there, that's a problem, okay? And the fact that we're allowed to have that stuff in the United States, it's not just in our houses. So I would ask that we take a hard look. I mean, every time I put Vector's Bock that I bought in Germany as a kid and I pull it out of the microwave and it is scorching hot, and I think, oh, it probably has lead paint in it, but I don't get rid of it because I bought it and it was a gift kind of thing. I need to think about what I'm giving to my children, okay? So please, please educate the community for us because we need the help, and we will take away the lessons learned tonight. We already have a list of things that we need to, and for those of you that want to talk specifically about your houses, please let us know because that's what we are here for, okay? I appreciate you very much coming out tonight. I know you probably got babysitters and things like that. The fact that you care about this community and that you want to make this community a better place is what makes Fort Leavenworth the best hometown in the Army. Because we are listening to you. I promise you that we are listening, and we will try to make this place better every single time that we have a class come through or we have permanent party here that want to make this place a better place. So I appreciate your time very much. You have no idea, and please come up to us afterwards. The last thing I'll leave you with is 684-5684. 684-5684. Rick Fields works for us. He is the person, and we're going to do newspaper articles for the lady in the back, newspaper articles, Facebook posts, everything like that. We're going to make sure people have all the contact information to make sure that they get the answers that they need, because we don't want you to be frustrated with that process. That's not what we're for. So Rick Fields, 684-5684 is my rep with housing, and he is the one that can deal directly with Ms. Healy and does a great job with that team. So thank you very much.
People right